Well, we are live and we are happy to see everybody logging in today. And welcome from Dallas, Texas. That's where I am, Gustavo Tolosa. And today we have like I mentioned other times, the one and only Dr. McDougall. And we are always so appreciative that Dr. McDougall, with his very busy and hectic schedule in his professional and personal life, he makes the time every week to be with us. And we will never be able to say thank you enough, Dr. McDougall. And with that, welcome. And how are things going in Santa Rosa?
Well, Gustavo, thank you. But again, even though I may say it many times, and many people doubt the sincerity, but it's true. The enjoyment in life comes from helping other people, and getting this opportunity with you and the thousands of people that listen at our weekly webinars gives me a chance to fulfill my life. I get to help other people. Whether you're a contractor and you build houses, or you're a florist and you arrange flowers, or whatever you do, the greatest enjoyment in life comes from helping others. And I learned this when I was a young man. That's what my dad used to tell me. And then he would also tell me, along with my mom, being a doctor gives you one of the greatest opportunities to help other people. So, to be with you every Thursday, I look forward to. I really do. And I miss it when Dr. Lim or Dr. Lyle take over. But they have so much important to say. I'm sure they were both excellent over the last couple of weeks. So the time I get with you, I value greatly. Gustavo, you have been encouraging me to address women. Women, of course, have been a great interest in my life. I dedicated this book to 3 women, the McDougall Program for Women. It can be bought probably for 50 cents in a used bookstore. I own the rights to it, and I may republish it. It's a good book, very good, dedicated to my mom and to Mary and my daughter. This book I wrote it about 25 years ago, the McDougall Program for Women. I'd encourage you to read it. It's, I don't think, as fundamental as the second book I wrote, which was about 10, 15 years earlier, which was this one, McDougall's medicine book. If you want to start learning basic medicine, I would start there and then move on to my books on heart disease and GI disease, and specialties in women and so on that I've written to kind of follow up. And that's what the McDougall Program for Women was. It was a follow-up on chapters in the medicine book, which was written in 85. This was 1985, so this was probably 10 years later. But I followed up on certain chapters, like osteoporosis. I followed up in that book. And also breast cancer and early detection for breast cancer and osteoporosis early detection. So I'd written things about this in 1985. What's that? How many years ago? God, losing track. 32 years ago. And I wrote this one maybe 22, 25 years ago. So the question is am I keeping up to date? And when you show either one of these books to your doctors, likely you're going to say, well, that's interesting, but it's out of date. No, it's not. The truth doesn't change. But anyway, I'm challenged to relook at the opinions I have, relook at the data that has come out. And I haven't done that for a while for breast cancer, but I did that this past month. I reviewed the data on the treatment of local disease. That means disease in the breast, not disease around the body. I'm going to do that maybe next month. But the treatment of local breast cancer in the breast. And that primarily means a surgical removal or radiation therapy to kill the local disease is the standard therapies. I'd have to say in the years that I've been in medicine, remember half a century in general medicine and 40 years in dietary therapy, my main interest, one of the things I like to read about most is breast cancer. And study about most and keep up with is breast cancer. So I'd say that's probably my passion as far as terrible diseases go, is this disease. Why? Well, this disease gets a lot of attention. It should, because it's in a very important segment of our population. That's the female gender. And what's more important than taking care of our wives and daughters and mothers? Nothing, really. So whenever you talk about women, you get a strong emotional response, as you should. A man can have a heart attack or prostate cancer. Doesn't get a lot of attention. Some, but breast cancer gets a tremendous amount of attention, and a lot of it's emotional for obvious reasons. We're dealing with women who have a very special place in everybody's heart, but especially men like me. I love my daughter and my mother and my wife. So it's national headlines when it's something about women. And breast cancer, of course, is the most feared of all diseases, not just by women, but also by doctors. The number one reason to get a malpractice suit is fail to early diagnose breast cancer. So it's on everybody's mind. It's one of the earliest cancers diagnosed and treated. Why? Because it's right there to see it. It's not like it's hiding inside your body in the colon or the prostate or the pancreas. It's just right there. And so there have been writings about the findings and treatments of breast cancer for 2,000 years. The modern treatment of breast cancer actually began in the Renaissance period. That's the mastectomy. And that continued as one of the standards of therapy for 600 years. This is modern therapy. A surgical technique invented more than 600 years ago. Standard modern therapy. Anyway, personal involvement has been great. Not my choice. When I was in high school, my Aunt Margie, they were very close to us. This was my mom's sister-in-law, my mother's brother, and their 3 children, 2 boys and a girl. We lived very close by, and we spent lots of time with them. We were a close family. Weekends and weekdays, we'd spend time with them. And I got to know our Aunt Margie really well. She was, as I remember I was 18 and she was in her 40s. Even then, I found her a particularly distinguished woman in terms of her speech and attractiveness and education. She was a very unique person, very intelligent. Well, when I was in high school, developed breast cancer. And of course, I knew nothing about it. But Uncle Ed and Margie, they went through the usual therapies. She got cured with a mastectomy, a radical mastectomy. That's where they take the skin over the breast, the muscles under the breast, the lymph nodes in the armpit, often the lymph nodes next to the sternum. It's called a radical mastectomy because it's radical, and that's what she had. And then it was followed by a Syrian dose of radiation, full dose of chemotherapy. By the way, these are the same concoctions, the chemicals that are used today in women in 2017. And I'll review that. It always shocks me. Here we are, more than half a century later. And women come into my office currently. I'm a practicing doctor. They come into me and I ask what their therapies have been. And they give me a list of chemotherapy drugs. Cytoxin, methotrexate, 5-fluorouracil, adriamycin. Excuse me, those are the drugs I gave when I was a medical student. What progress is made in 50 years? Or actually since World War II, which is when these poisons were developed. Well, Aunt Margie, she was a faithful patient, lost her breast. Next, what they did is they took her right breast off. This was her left breast. They took her right breast, they radiated that area, and they gave her more chemotherapy, and they continued to torture her for 4 years. Now, I do mean torture her because they knew better. The effectiveness of these therapies has been questioned since they've been invented. For the last 100 years, the treatment of breast cancer in terms of local disease. Now, please try and remember I'm talking about local disease. That's disease on the chest wall. The treatment of breast cancer over the last 100 years has been from one extreme to the other, from doing nothing to a more than radical mastectomy, where some surgeons over the last 100 years took the breast, all the skin on top of the breast, all the lymph nodes in the armpit, the pectoralis muscle on the chest wall, and the arm on the affected side. And no difference in survival. The current standard, that was the standard when I started in medical school, was the radical Halsted procedure, invented by a famous surgeon named Halsted. And what he did is he took the skin and the breast and the muscles and the lymph nodes. And that became the radical mastectomy, which was the standard of therapy for the next 70 years, from 1882 to 1950s, and even when I started school in the 1960s. It was rare a woman didn't get a radical mastectomy. About 1950, modified radicals came in, and they took everything but the chest wall muscles. And then research was published by Bernard Fisher. This all happened in my time. I mean, I saw this. This is right in front of me. Bernard Fisher did a randomized controlled trial published in the New England Journal of Medicine with a 25-year follow-up, comparing people with different degrees of aggressiveness of breast surgery with kinds of surgery and radiation. Doing a radical mastectomy versus doing a lumpectomy with no radiation. No difference in survival. They live the same length of time. That was started in the 60s, published in the 70s. There's a 25-year follow-up showing that no matter how much breast you remove on the chest, whether it be by surgery, and I'll tell you in a minute, or radiation, you don't change the day of death. Overall mortality is not changed. But we'll get back to that. Let me go back to my family. So I lost Aunt Margie. She was 53, and I was barely in college. The next time breast cancer touched our family was when my sister-in-law developed breast cancer at age 28. And at that time, my brother and her had two preschool children. And she developed breast cancer. And, I have to admit, my sister-in-law and I were not on best speaking terms ever. Had nothing to do with her breast cancer. It's just that, sometimes you just don't get along with people. And I don't think she had much respect for me. Even though at that time, 20 years ago, I told her, you got to change your diet. It's going to make a huge difference. Rather, her approach was standard medical care and many non-conventional therapies, and she took it all. I mean, everything available. Breast removal, radiations, chemotherapy, everything. And she died at 32, leaving my niece and nephew and my brother, also leaving them bankrupt, even though they had great medical insurance. And, he's a physician himself, good job and everything. They went bankrupt, and they had to live in my parents' basement for a year. So breast cancer's touched my family a couple of times. So I maybe that's why I personally got involved in it young in my career, the interest of breast cancer. And a couple of things that happened to me along the way, I think are very notable. I'd like to share them with you. In about 1982, when I was living in Hawaii, a group of citizens approached me and asked me if I would support a bill of informed consent. Informed consent. That means that the patient, in this case a woman, will be given by her doctor sufficient information to choose the benefits and the risks of therapy and to help her decide which would be best for her. There have been 2 other informed consent laws passed by that time, one in Massachusetts, one in California. And so the third was supposed to be in Hawaii. As of 2008, by the way, there are 22 states that have similar informed consent laws, which force physicians by law to tell women information. I mean, think about it for a minute. So I was asked to testify. I said, okay, I'll testify. And I went in and talked to Ben Cayetano, who was the senator at that time. And we sat down. And by the way, you will find the whole story of this. You want to read it. So I gave it in detail, including naming names of the head of the Cancer Society and the doctors that were involved. It's right here in the introductory chapter. So I wanted to make sure they got proper credit for what they did. So it's all there in the introductory chapter. They asked me to help to get a law passed in Hawaii that would force physicians to tell them basic information about their treatment, like, for example, what Bernard Fisher did, his studies published in the New England Journal of Medicine, accepted by everybody, no research to question it, showing that it didn't matter how aggressive the surgery was, the day of death was the same. Women were told that. At that time, in fact, 93% of women in Hawaii received a radical mastectomy. So the 7% who didn't, they were too sick for the surgery. Anyway, I went to this meeting with the lobbyists from the the Hawaii Medical Association. She was the lobbyist, and whether it's relevant or irrelevant, she could stand to lose 100 pounds herself. And Ben Cayetano and I sat down for this meeting. I discussed with him this consistent scientific literature, and that women ought to know whether they have, their whole right side or left side amputated, or they just have the lump taken out. The results are the same in terms of survival. Ben Cayetano agreed. The lobbyist was mad. Well, it wasn't but a day or two until the next meeting was scheduled with Ben Cayetano, the lobbyist. And this was held in a building and industry department meeting. Who knows? It had nothing to do with healthcare in Hawaii. But they slipped it into another meeting. They didn't invite me. But they did invite the professors from John Burns School of Medicine at University of Hawaii. They invited the doctors from the Hawaii Cancer Society, the Hawaii Medical Association, invited Tom Whalen, who was head of surgery at the Queens Medical Center. All of them were there, all the big shots, to say that we don't need a law that forces physicians to give patients information. So I got a phone call. I'm busy seeing patients that afternoon, and I got a phone call, and they said, John, we hate to tell you, but the bill for informed consent is back in committee. I said, it can't be. It was passed. Ben Cayetano said it was passed just a couple of days ago, and it would go on to the full vote of the congressional body. It can't be. They said it is. So I closed the afternoon of practice, and I drove to the Capitol, where I took a spot around a huge table filled with doctors and scientists and legislators. I gave my testimony. It was like a 6 or 7 page testimony, which was handed out to everybody also. And Joan Evans was her name. She was the senator. She'd already lost both breasts, and her daughter had lost one breast through surgery at that time. She was the chair of the meeting. And after I gave my testimony, they asked for a response from, the real doctors. I remember Tom Whalen, the head of surgery. He said, we don't have to inform our patients. We already do. We already tell them the options. I said, well, Dr. Whalen, will you explain to the committee what you tell your patients? Sure. He says, I sit them down, tell them they can have a radical mastectomy or a lumpectomy. And then I show them a consensus paper, which clearly shows that the only sane thing to do is to have a radical mastectomy. And I said, that's informed consent? Well, of course, no doctors. What they did, you walked into a doctor's office as a woman with breast cancer, and you got whatever the doctor liked to do, which happened to be, in that case, at that time, radical mastectomies. The radiation business was kind of creeping in there, with radiation after a mastectomy, but they were killing more people, so it didn't get too popular. But it changed things. Before informed consent, over 77% of people and 93% in Hawaii would get a radical mastectomy. After informed consent laws were passed, after the studies came out, mastectomy rate dropped to about 30% of women. Okay, I'm a few points off. And they went instead to from a radical or modified radical, they went to a lumpectomy, where you just take the lump out and then you give a huge course of radiation to sterilize the breast. And that change did take place all over the country. Again, it took 22 states to pass laws against physicians' behavior. Anyway, they continue to break it. You can't stop them. So we got done with the meeting, and Evans, Senator Joanne Evans, lost 2 breasts, daughter lost 1. She took my testimony, and she went around to each doctor from the university, Hawaii Medical Association, Hawaii Cancer Society, to each doctor in the Capitol room, and said, you've read Dr. McDougall's testimony. Why shouldn't we give this out as a brochure to all women who get breast cancer? They could provide no reason why they shouldn't. So they said, well, as our final act, what we're going to do is we're going to assign the Hawaii Medical Association, the Hawaii Cancer Society, the job of assembling a brochure which must be handed out legally to patients. An informed consent brochure. It's your job to do it. And I stood up and I said to Joan Evans and the rest of the group, you will be getting an advertisement for a mastectomy. Everybody giggled. About 4 weeks later, I got a phone call from one of the senators, and I believe it was a man, explained to me that we have an advertisement for a mastectomy on our desk. So I told you so. What do you expect? Anyway, that required a meeting between myself and the Hawaii Medical Association. And so they showed up and I showed up. You got to remember, I'm just a kid. Like I'm 28, 32 years old. I don't know, maybe 30 years old. And these are head of surgery of the University of Hawaii, John Burns School of Medicine, and all the top dogs. So it could have been threatening. Except I just somehow don't react to those kind of threats very well, and it didn't bother me much. But I did come prepared. I came to the luncheon meeting at the Hawaii Medical Association, and I brought with me a stack of scientific papers. And this stack of scientific papers I put right in front of me at the table. By the way, it was my side of the table. They all sat on the other side of the table. I sat and ate my mashed potatoes and corn, and they had their usual. And they started talking about a bunch of peripheral BS, garbage. I told you I was going to use clean language on this show. Just peripheral stuff, nothing to do with this law they had to deal with. And we're getting 20 minutes into the meeting, and the meeting lasts a half an hour, and here we go again. We have a mass murder in the United States from gun use. And what do they say? Well, now is not the time to talk about it. Well, we have mass murder created by physicians. And these physicians have been outed by scientific research, but now is not the time to deal with it, was their attitude. So anyway, I said to him, I said, look, if you know a single research paper, and I must have had 300 research papers in front of me. I said, I got them all here. If you know of a single paper that says that surgery improves survival, point it out to me and we'll look at it together. They couldn't find one. So I said, well, guys and gals, until you comply, you're breaking the law. And you best provide for what the law requires and the brochure, which is the intent of the law. Because I'm not stopping until you do. Anyways, Ann Carr, pathologist from the Queen's Medical Center, woman pathologist. After all of this, she writes me and she said, we're ashamed of what we've acted. And I, as a woman, I'm particularly ashamed of what's going on. You realize this is a male-dominated medical business. We don't treat men with prostate cancer the same way we treat women with breast cancer, even though they're analogous diseases. We give men serious breaks, like one option that's been around for a long time is no treatment at all. You got radiation and surgery, but men have always been offered conservative therapy, don't treat. But now women, same disease, different gender, I believe. Anyway, Ann Carr asked me to write this brochure. I wrote the brochure. It talked not only about the scientific issues you need to know about as a woman with breast cancer, but it also, Ann Carr, she said, will you put a paragraph in there about how important it is for women to change their diet after they get breast cancer? And I said, I will. I handed the rough draft in. It was approved overnight. And it's still the legal brochure in Hawaii. I don't know what other states have, but if you go to Hawaii, legally, they must give you a brochure I wrote in 1982. So how did my colleagues respond? I had a radio show that played all over the state every Sunday night. For Your Good Health, I think it was called. Very popular. A woman called me up and said, I was just diagnosed as having breast cancer. I had both my breasts cut off and radiation. They want to give me chemotherapy. And golly, doc, what should I do? I said, well, how many brochures did you get? Brochures? I didn't get any brochures. Well, I said, by law, the doctors in Hawaii who treat women with breast cancer, by the way, in other states, if you treat prostate cancer, there are similar laws. You have to comply with informed consent. And in the state of Hawaii, that means you have to be given this brochure that tells you it doesn't make a damn difference how much breast you cut off, and that you ought to change your diet. So the lady, was in tears. What should I do? I said, well, tomorrow morning, the attorney's office is open in Hawaii. Give them a call. You can't possibly lose because your doctors have been breaking the law, and they should be held accountable for it. Well, the next Hawaii Medical Association newsletter was all about how important it is to comply with the informed consent law in Hawaii and to give out the brochure. Unfortunately. So I told you, mastectomy rates dropped from like 90% to 30%. But, people forget. They get back into old messages like you must eat meat to get protein, and you must eat calcium or milk to get calcium, and all kinds of other lies that are associated with big business, unique positioning. It's just advertisements. Well, mastectomy, you can imagine, is a bigger operation. Throw a little radiation in, it's a bigger treatment plan. You're talking about a lot more money, particularly for the surgeons associated with mastectomies as opposed to lumpectomies. The total bill is about the same. If you have mastectomy, the breast cut off, or lumpectomy plus radiation, the bill is about $15,000 to $60,000. But somebody wants that money. And if I happen to be trained as a radiotherapist, and I'm going to tell the patient when she comes in and her husband, radiotherapy is the way to go. And what do you think the surgeons are going to say? They're going to say that radiotherapy that's too brutal. Doesn't add anything to what I do. And the chemotherapists, they're going to say, both the surgeons and radiotherapists, they're nuts. The way to treat this disease is with my chemicals. It shocks you as a patient when you go in for different opinions and you find out just how different they are and how closely they are associated with the provider's means of paying for his or her Mercedes. Well, anyway, we have 22 states as of 2008. There may be more now that have informed consent laws. And my guess is if I went around to these various states, interviewed doctors involved with breast cancer, that not a one of them comply. They're breaking the law. So if you happen to be treated that way and you happen to be legally oriented, sue the bastards. Did I say that? Probably not. I probably didn't say that, but don't cut it out. Sue the bastards.
You're right.
Okay. Anyway, so mastectomy's back. It went up from 30% to like 38% back in the early 2000s, and now it's gone up 36% since I think it was 2008. And the number of double mastectomies, taking one breast off is not enough, has tripled in the last, about 10 years. Tripled. So the business is swinging in a direction of brutality. A barbaric therapy used as a standard therapy in the Renaissance 600 years ago is now the most popular therapy. Didn't work then, doesn't work now. Barbaric and brutal. Well, anyway, some people objected to this along the way. This is not without any dissension from fellow colleagues of mine. The truth's the truth. You can see it in the studies. You can see it in the practice of your fellow colleagues. You can see what they're doing to women. You can see how little chance families have. And one man that really stood out, who I knew, was George Cryle Jr. from Cleveland Clinic. He happens to be Caldwell Esselstyn's wife's dad, George Cryle. I believe that's correct. You know, Caldwell Esselstyn is. But anyways, his George Cryle Jr.'s dad, I believe, set up Cleveland Clinic. And in the 50s, George Cryle Jr., who I know, I personally knew the man. You know, I can't tell you how much fun we had one afternoon and showing stories together. But it's a memory I'll never lose. Two of his wives died of breast cancer. George Cryle studied this disease very carefully. He started doing conservative surgery and did his last mastectomy in 1954 and told other doctors this is brutal. You should. The Cleveland Clinic. His dad founded Cleveland Clinic. I mean, he's just taking off the lump. No radiation, nothing. That's what he recommended for many patients. And so have many other doctors along the way, including myself. Since I've been in this business, now remember, one of the reasons this is so near and dear to me is I lived this. I lived with these studies of mammograms and radiotherapy and surgery. That's been my career. I knew these people. I knew Bernard Fisher. I mean, I didn't know him personally. I knew George Cryle Jr. personally. I knew the studies backwards and forwards. And this continues to go on unabated. In my opinion, it's in part because of gender bias, and mostly because of ignorance, and even more than that, it's just business. Don't take it personal. Anyway, what I've recommended for 40 years, still recommend without waiver. Nobody's criticized what I say. Not a single person, not a single doctor, not a single patient. Is I recommend that if a woman gets a lump in her breast, and how she discovered it, she discovers it by taking a shower and she feels a lump. She doesn't do routine breast self-examinations. Those are harmful because you find too much non-disease. The Canadian Task Force on Preventative Medicine has recommended since 2001 to not do breast self-examinations. Yeah. The U.S. Preventative Services Task Force on Medicine, our task force, the most respected body in this country on medical recommendations, has since 2010 recommended not teaching breast self-examination to women. Because you find too many things that aren't cancer, and you end up with too many tests and too many treatments. And so when do you find it? You find it if you're in the shower and you find a lump, you take it to the doctor for an examination. No rush, really no rush. It's been growing there by the time you can feel it for 10 years. And then what you do is you instruct the doctor that you want the tumor removed. That's it. You'd like to have clear margins. In other words, you'd like to have around the tumor some area that has no cancer cells in it. That's the goal. Although really, honestly, it doesn't make much difference. In terms of leaving cells behind and then reoperating, there's very little difference in overall chances of living, overall mortality. But it makes sense. I've taken care of 6 women in my career who have refused all surgery. And that's not a good idea. You do need to control the local area in the breast because these cancers, they grow and they end up in tumors that look like a piece of hamburger on your chest. And they're oozing and messy, and it's not a good thing to do. So you really need to treat the local disease carefully. So I've had about 6 patients who have not, and I've seen what happens. So what I do recommend is adequate control of local disease, which can be accomplished almost always, and I mean almost always, I need to clarify that a lot, most of the time by just a little surgery, especially if you get clear margins. The figures given are that if you do local treatment, just a mastectomy, the recurrence rate's about 30-40% locally. Still, that means 60% of the people didn't have to have any further treatment. Save that for those who do. And if you add radiation to the lumpectomy, you reduce the local recurrence rate to 10%. If you do a mastectomy, the local recurrence rate is about 10%, as opposed to 30 or 40% if you just take lump out. The nice thing to realize is if you just do conservative surgery, a lumpectomy, and hopefully you get clear margins. If you don't, I usually don't recommend reoperation. But the goal is to get clear margins. And if it comes back, what do? A little more surgery. And if it comes back too big for a little more surgery, then that's when you take the arrow out of your quiver called radiation, and you control local disease with radiotherapy. Survival's the same. Doesn't make any difference. And I've looked at the new studies. Now, the reason I've looked at the new studies, and by the way, do I give chemotherapy? No, not routinely. And do I give hormone therapy like taking the ovaries out, tamoxifen, or aromatase inhibitors? I do, with some caution. And that's discussed in the newsletter that I just put out for you. All this is in the newsletter that just came out in September of 2017. With the links, you can hit the links. There are the studies. You read them yourself. So take the tumor out, period. Do not touch the lymph nodes in your arm. You'll cause yourself harm and no good. And I gave you 2 recent papers published on that, where women had breast cancer, they had breast amputations of one degree or another. They had the usual global radiation to the breast area, and then they had intensive radiation to the armpit. No survival benefit. They compared taking all the lymph nodes out in the armpit versus just taking one out. No survival benefit. I had to review all of this because, as you know, we see a lot of patients at our clinic. Right now we have 70. December, I heard, is sold out. Will be 55 or 60. And I have another doctor who you met last week, Dr. Anthony Lim. Phenomenal young physician. Yeah. If you watched him, you know that I can't say enough good about him that he doesn't deserve. But he's also a questioning man. I mean, he's an attorney. He's Harvard trained. He's been with lots of doctors. He is very respectable. And he's not going to prescribe any questionable therapy to his patients, who are the patients who come to our clinic. They're his patients. I mean, they're my patients also, but I mean, he is directly responsible for them. And so one of the hardest things for him to give up was to add radiation after a lumpectomy. He said, clearly, the addition of radiation improves survival after just taking the lump out. I mean, here's a review from Lancet in 2014 of nearly 11,000 people, and another review, but particularly this one review of 11,000 people. And it shows a survival benefit because the idea being you've got the tumor in the breast. Well, what happens is that tumor spreads by the lymphatics and the veins to create satellite lesions in the breast. And also sometimes the breast is multi-center and starting, it's not just one place. Usually, I mean, when you get breast cancer, it's breast cancer of both breasts, not just one breast, or both breasts. And pretty much all tissues are involved, and there are various changes from normalcy to malignancy. But you find this one set of cells dividing at a leading rate, and that's the tumor you find. So the idea being that if you take the tumor out, good, but you want to sterilize the breast of any cancer cells that were left because they're satellite lesions spread through the venous and lymph system, or they just happen to be there for normal development, or the doctor left it behind, or so on. And so radiation has been the normal recall, which almost every physician that I've known until even recently is too afraid, this is fear-based medicine, to offer the patient what the science says works and does least harm. You're all chickens. And you ought to be held accountable for it too. And someday somebody will. Well, anyway, what the studies show, the meta-analyses, I showed you 2 large studies done on quite sick women, and mortality benefits were in the matter of, just a handful of people. They got the radiation, but it was statistically significant. That's all you got to do is just get that tiny p-value to be right, and then you can unleash your therapy without guilt. Anyway, I cited for you the couple studies done on severely ill people with radiation. It shows a barely minimal increase in overall survival. The problem of interpretation, which shouldn't exist for intelligent people, is they misread the data. And they mispublish the data. And they do that with intention and full knowledge and it's dishonest. And they ought to be held accountable for it, I think. What they report in these studies where they compare, say, giving just a lumpectomy or a limited amount of breast surgery with radiation or no radiation. What they find in this multiple studies done is there is consistently a reduced risk of dying of breast cancer. Let me say that those few short words again, because you've got to hear them. A reduced risk of dying of breast cancer. But there's no reduction in overall death rate. That's the problem. And the one they kind of sneakily hide there in the data. Absolute mortality. And if you busily look for absolute mortality, after all, what does a woman want to know? She goes to the doctor. What she wants to know is, how long am I going to live? And what therapy is going to allow me to live longer? That's what they want to know. Well, that's not what the doctor reports. The doctor reports is this therapy has consistently been shown to reduce local recurrence. I told you it does in the breast. And as a result, because of the way we do autopsy data, classified deaths, and so on, when you count up the autopsy reports, there is a definite reduction in autopsy diagnoses of dying from breast cancer with radiation. Unfortunately, the treatments and tests kill. The risk of dying of heart disease with radiation, if they do it to the left side of the chest, is increased by 2 to 4%. A certain number of people die from anesthesia, blood loss. As a result, it's overall mortality that counts. You may save me from breast cancer, but and that may be 30 years from now that you save me from dying of breast cancer. But if you put me on the operating table and I have an anesthetic reaction, I'm dead today with my 3 and 4-year-old. Anyway, they're dishonest when they report breast cancer mortality. And that's what Dr. Lim and my son, Craig, they were focusing on. The studies did. Look at them. They're all real clear. They show a reduction in breast cancer mortality with radiation. Yeah, but I said, son, and Dr. Lim, that's not what a woman wants. She wants to live longer and better. And the studies do not show that. They show they do not live longer. Overall mortality is the same. Anyway, that's the way you've been treated. You're being lied to. The people who are lying to you know they're lying to you. They have access to the data just like I do. I happen to take the scientific references for you. I put them in various books that I write so you can look it up. But these days, I don't even do that with modern technology. What I do is I have Neil Hendrickson, who publishes our newsletter, make these easy links. So you want to read Fisher's work at 25 years, showing no difference in survival, no matter how aggressive you are with the treatment of the local breast disease. 25-year study up, just bang, it's there, free. You want to see the study that shows, and I showed you the best study. They all say the same, basically. You want to see the study on aggressive treatment of the armpit with radiation? No benefit. Taking the lymph nodes out, one lymph node versus taking all of them out and giving you an arm with lymphedema, which is swelling and pain, no benefit. They're all there. You can read them. So what do? As a patient, you're helpless. You really are helpless. You go into the doctor armed with the first chapter of this book, armed with the chapter on breast cancer. By the way, both those chapters are in the September 2017 newsletter. You tell the doctors an extra $500. You read these chapters in this newsletter, and you tell me where McDougall erred. And then I will feel like we've begun a discussion of informed consent. Otherwise, you're breaking the law. That's what I would do. If you're talking about living the rest of your life without your breasts, one of your breasts, two of your breasts, living in fear of dying of cancer, unnecessarily in many cases, it's a big deal. You need to take the trouble. So anyway, I've reviewed the data up to September of 2017, and I have not changed my recommendations in 40 years. And nobody's asked me to, and nobody will ask me to either. Take the lump out, your margins, don't let them touch your lymph nodes, don't take chemotherapy, consider hormone therapy. Get the second breast taken off just for something to do, and change your diet. Remember, my February 2015 newsletter says if you change your diet according to the scientific research, you'll live longer. And the American Cancer Society says that doctors must tell patients that. Well, as long as you're going to court with your lawyer, you might as well assume over that too. I just want things done. Gustavo, I went way too long. Mary and I have to go get a photo taken with the Whole Foods people right now.
Dr. McDougall, this has been
70 people standing by the flamingo waiting for Mary and I to show up with a big smile.
You have done one of the most amazing webinars that I've ever heard. And this was truly life-saving. I want everybody to make sure that you can print. You see, I printed your newsletter. It has all the links, to the research. You guys have to have this. This is life-saving. And then you need to watch this webinar 2 or 3 times or more.
And remember how to read the research.
Right.
Death from breast cancer, death from colon cancer. You're just changing your form of death.
Right.
That's all these tests and treatments do. They just tell you the tests and treatments kill you, usually more immediately than the disease would. You may end up, and that may be one reason you have less chance of dying of the disease. You're already dead from the anesthesia. Oh, here we go. We know how to reduce the risk of dying of breast cancer. Let's kill them with the anesthesia. Come on in here, Mary, and say goodbye. Doesn't she look ready for a photo?
Oh, Mary, yes, there she is. Okay, let's see. Okay, go ahead, steal it. It's yours. It's yours.
Okay.
All right.
We have to go get a picture taken, and of course we'll see you guys.
Very good, very good. We will do questions next week with you, okay, Dr. McDougall? Because
we can do that. Please read the women's book,
right,
which may give you the chapters too,
and the newsletter.
Read the newsletter. All the articles pretty much are free, full articles, open access. You can read them. Take them to your doctors. I gotta go. Goodbye.
Goodbye, everyone.
My God. Okay.